If you or a loved one are 21 years old or older and have a cervix, this is a public service announcement to inform you of the importance of cervical cancer education. According to the CDC, there were 12,733 new cases of cervical cancer diagnosed in the U.S. in 2018. Cervical cancer is a prevalent issue in the United States, but because of early detection through yearly pap smears and pelvic exams, death from cervical cancer is relatively uncommon. It is important to know what cervical cancer is, how to detect it, and most importantly, how to prevent it. Early cervical cancer may produce no symptoms or very vague symptoms, such as thin, watery discharge after sexual intercourse or douching. As cervical cancer progresses, you will start to have more noticeable signs and symptoms, such as pain and bleeding with sexual intercourse or vaginal discharge that is dark and foul-smelling. If you have experienced any of these symptoms, please notify your primary care physician or gynecologist to schedule a pelvic exam and a pap smear. In situ cervical cancer, which is cervical cancer that is on the surface of the cervix and has not yet spread to the uterus, has a survival rate of 100%, so early detection is essential. Early cervical cancer is detected through assessment of the cervix by a pap smear and a pelvic exam. If abnormal cells are detected, a biopsy will be completed to diagnose the cancer. In more advanced stages, large red growths or deep ulcerating lesions may be viewed through a pelvic exam. Some of the risk factors for the development of cervical cancer include exposure to HPV, current HIV infection, immune deficiencies, chronic cervical infections, overweight status, prolonged use of oral contraceptives, sex with uncircumcised males, and smoking and exposure to secondhand smoke. Treatments for early cervical cancer include cryotherapy, laser therapy, or removal of abnormal cells through a procedure called the LEAP procedure. Simple hysterectomies are recommended if you are past childbearing age. Advanced and invasive cervical cancer may require radical hysterectomy, lymphadenectomy, or trachelectomy. After surgery, it is not uncommon to still have to undergo radiation or chemotherapy. This is why it is so important to prevent and detect cervical cancer early so that extensive treatment can be avoided. Prevention is key, and the most important preventative measure is to begin yearly pap smears and pelvic exams at the age of 21. Prevention can also include smoking cessation, HPV education and immunization, and the proper use of condoms and safe sex practices. Please see your practitioner if you have any of the previously mentioned risk factors for cervical cancer. If you have a cervix and are 21 years of age or older, it is time to get your yearly pap smear and pelvic exam so that you can protect your health by preventing and detecting the early stages of cervical cancer.